Welcome to Mount Sinai Live. We stream smart healthcare information that's simple to understand so you can improve your health. I'm Dr. Jimmy McKay, and I'm your host. Today, we're talking about multiple sclerosis. Audience, remember, if you have any questions or comments during the live stream, feel free to drop in the comments below on whatever platform you're watching on. To educate us about multiple sclerosis is a Mount Sinai Hospital Multiple Sclerosis Fellow, Dr. Sammita Satyanarayan. Let's welcome Dr. Satyanarayan to Mount Sinai Live. Welcome.
Hi.
We're talking about multiple sclerosis today, something you are well equipped to answer. So let's start with something easy. The symptoms we should be looking out for with multiple sclerosis. Talk to us about that.
Absolutely. Thank you so much for having me. So there can be a lot of different types of symptoms with multiple sclerosis. And multiple sclerosis, or as we say, MS, is a disease where a person's immune system starts going after their own brain and spinal cord. So in relapsing remitting MS, there's inflammation that can sometimes build and leave a scar in the brain or spinal cord. Those scars are called lesions, and we can sometimes see them on an MRI. Not all areas of inflammation in MS necessarily causes symptoms that people feel. Think of it sort of like traffic. You know, if you have a small fender bender in a quiet neighborhood road, that might not cause you any type of traffic delay because you can just go around it. There's plenty of ways to get to the main road. But if you have that same type of accident on a crowded highway during rush hour, you're definitely going to feel that traffic delay. So in a sense, that's sort of true for our brain and spinal cord also. There are areas of the brain and the spinal cord that are more like neighborhoods and some that are more like highways. The only difference is we're not carrying cars. It's our sensations, our actions, and our thoughts. So that gets back to your question, which is sort of what are the symptoms of MS? And that completely depends on where the inflammation actually is. Some people can have painful vision loss if the disease involves the optic nerve, which takes visual information from the eye to the brain. Some people can have inflammation of the spinal cord, and that can sometimes affect the sensation or strength in your arms or legs. Sometimes could affect urination, bowel movements, or sexual function. And then people can also have lesions in their brain, and that can cause symptoms like numbness or tingling in their face, trouble with dizziness or balance, double vision, and even sometimes trouble with cognition or memory. There are a few important things to know about symptoms in MS. First off, not everybody's guaranteed to have everything that I just mentioned. In fact, some people only ever have one. And in general, these aren't things that come and go over the course of just a couple minutes or an hours. They usually worsen over days to weeks at a time before getting better. And it's important to say that new symptoms in relapsing remitting MS can improve. Another thing that's important to know is not all symptoms in MS represent something new. So for people who already have MS, they can sometimes get echoes of their old symptoms if their body temperature is really elevated. So if they're really sick or it's a really long day at the beach, and those symptoms can come and they can go away once they cool down. They're not dangerous. The most important thing to know is that the MS treatments these days have gotten really good at doing what they're doing. And the goal is to really prevent any new symptoms.
So we talked about the symptoms and what you should be paying attention to. How about diagnosis? One step further, how do you diagnose multiple sclerosis?
That's a great question. In our fields, we recognize that MS is a big diagnosis. It's a life-changing diagnosis. And unlike other diseases out there, MS doesn't just have one blood test that we can run and make the diagnosis. So that makes us as doctors really careful and really comprehensive in our approach to diagnosing anybody with the disease. The big picture is we want to make sure that we're excluding other types of diseases that maybe don't need immune treatments or need other kinds of treatments. And then we want to make sure that a person's symptoms actually fit with MS. So we use different pieces of information to really convince ourselves that this is a disease process that's happened in multiple places and over multiple time points. Actually, hence the name multiple sclerosis. The types of information we use are things like clinical symptoms, MRIs, sometimes blood tests for other diseases, and sometimes spinal fluid. Just to get into a little bit of detail about those, with clinical symptoms, we look and see what's affected. We look at the time course of the symptoms. We do a physical exam to see if we can find signs of injury to the nerves. And we see if all those are consistent with what we expect in MS-related inflammation. We look at imaging. And not just to see, is there something on the MRI, but we're really looking to see if there's something specific for MS on the MRI. So we use the appearance of what we see, the shape, the orientation, the location of what we're seeing on the MRI to see, is that characteristic of MS. And I told you that we don't have a blood test for MS, which is true, but we do have blood tests for other kinds of diseases. So there are going to be times where we are getting blood tests in the diagnostic process to rule out other diseases. And then there are times where we need some more information to really help us figure out this isn't something else, or that this isn't just a one-time thing. And sometimes we do a bedside lumbar puncture, also called a spinal tap, where we look at clear spinal fluid, which is a kind of fluid that surrounds the brain and the spinal cord. If there's inflammation in the spinal fluid that's not there in the blood, that can be suggestive that there's an inflammatory process in the brain or the spinal cord. But it's still one piece of the puzzle. And we as your doctors are trying to fit all of these pieces together. So we actually have an internationally approved set of diagnostic criteria to be actually able to make the diagnosis of MS for someone.
At Mount Sinai, we have something a little unique, a little special, the Corinne Goldsmith Dickinson Center for Multiple Sclerosis. Talk about what makes that so special.
Absolutely. The CGD Center for MS, as we like to call it, is a absolutely wonderful group of people at the School of Medicine at Sinai here that treat MS, as well as other neuroimmunologic disorders like NMO, MOGAD, and sarcoidosis. I think one of the things that makes this place really special are the people. You have doctors who are deeply invested in all aspects of doctoring, whether it's taking care of people, doing the cutting edge research that helps advance the field, or even educating the next generation of doctors about MS, like me. In addition to physicians, we have neuropsychologists who are really invested in learning more about cognition in MS because we know that that's important to our patients. We've got a group of amazing nurse practitioners who are really dedicated to the care and the well-being of our patients, an incredibly amazing and resourceful social worker to help all of our patients, and really, really incredible administrative staff behind the scenes who are helping patients with getting medications and forms and really anything else they need from us. And you asked me about what makes it special. And I think there is one other thing, which is that I think our center has a really unique focus on the whole person. You know, right now in our field, despite all our advancements, our treatments are preventative. They help you for the future, but they don't necessarily help you how you feel right now. And that's important because while a big part of our job is to make sure that things don't get worse, we also want to see people feel better. And we know it takes a village to get there. We know that diet, sleep, exercise, and mood, these are things that impact muscles. They impact energy and cognition. And these are the things that our center is really invested on working on with people because these are the things we just have to know about. We have to be researching these. We have to be finding the best ways to help people not just survive, but really thrive. And that's because that's who our patients are. You know, they're not defined by having MS. They're defined by all the other things that they're doing in their lives that are so important. We want to help them keep doing that.
Well, it sounds like you really care about it, how special that is, just by the way, how you talk about it. You talked about research. You alluded to that just a little bit a second ago. Tell us about research on MS and what we're learning now.
Absolutely. So we are involved in a lot of different kinds of research at Sinai, and we're always looking for anyone who wants to get involved with that effort. That's how we push the field forward. And everything we know at this point in time about all the therapeutics available for MS is because there have been people before us who've been willing to give their time to MS research. And so, you know, at CGD, we're involved in a lot of different types of clinical research. Right now, we're involved in a clinical trial that's testing a new kind of therapy for people who have progressive disease. We are involved in longitudinal research projects, which is where people don't have to take anything. They just help us by monitoring their disease and their symptoms over the years, because that degree of time actually helps us really deeply understand MS as a process. A unique aspect of research at our center is actually understanding the impact of MS on cognition, the role that diet might play in MS, and understanding the gut microbiome and its relationship to MS. My particular focus in research so far has been in understanding how social disparities of health can actually impact access to care and even disability, both in MS and neuromyelitis optica spectrum disorder. I think it's really important to think about because in addition to learning how to treat people better, we really want to make sure that we're understanding the relationship between all these other factors in a person's life that can really affect disability in MS. And then the last thing I'll say is, in addition to looking for people with MS, we're also always looking for people without MS or other types of conditions, or even people with no medical problems at all. So if you're a person with MS or a person without MS and want to get involved with our research, please feel free to reach out to one of the physicians at our center or call our clinic to talk to a research coordinator and see if you'd be eligible for any of these studies.
Excellent. Thanks so much for the insight today. You can find us at Mount Sinai NYC on all major social platforms. This has been another Mount Sinai Live broadcast. We stream smart healthcare information that's simple to understand so you can improve your health. I'm physical therapist Dr. Jimmy McKay. Thanks for watching.